Thank you so much, very much for the invitation. It's a pleasure to be here. My name again is Rebecca Edwards, and I'm a Dutchess County legislator from the town of Poughkeepsie. And Joel here is your representative from Rhinebeck, whoever you are in Rhinebeck. Joel has been around a while. I am new. I just got elected last November and started serving in January, so all my answers are very provisional and might involve, Joel, what's the answer to that? So we'll see how it goes. One of my new colleagues said, so I just want to follow up with what Bradford Kendall said a little bit about what it might mean to jump in if you are interested in county government, want to track what we're doing and how we do it. The legislature meets once a month for our main legislative meeting. It's at 22 Market Street in Poughkeepsie, and all of that is videotaped. So if you want to come to the legislature and watch, there is a public comment period at the beginning, which is limited to things that are on the agenda that night, and everybody's limited to 3 minutes, but you can come and weigh in. And as many people as come and weigh in, and then afterwards at the end of the meeting, you can weigh in on anything you want to. So I encourage people to come, but also if it's a snowy night in January and you want to stay home in your pajamas and watch us on video, sometimes I want to do that too, but I have to be there. But you don't have to be there, you can watch us at home. So, and they're all the back meetings, all the way back for a fair distance, at least a decade or online. Prior to each meeting of the legislature, in the week prior, there are 2 other meetings. We just had one this past Monday night, which is caucus night. There are 25 legislators. Right now there are 13 Republicans and 11 Democrats, so the Republicans control the chamber, but it's fairly close. The Republicans meet at 5:30, and the Democrats meet at 6:30 in separate caucus rooms. And those are open meetings. You can check and make sure, because sometimes there's something confidential and they have to, but basically the legislators have what's on the agenda for this month before those meetings, and we use those meetings to say, okay, what are the things here that are consent? Go on the consent agenda, which just means, okay, we all agree, the county needs to buy 2 bulldozers. None of us has any disagreement about that. We're not going to debate it on the floor. We're just all going to go, yes, buy the bulldozers. And so then you'll see a consent agenda when we come to the legislative session, which is often fairly long, that just says, okay, these are things everybody's already agreed to. And the clerk reads out the numbers of those resolutions, and we move on. Caucus is about figuring out which are the non-consent things. Where is there a question or a concern or an issue or something that really needs to be debated? And those are the issues we talk about more on caucus night. Then on a Thursday night, and if you want to watch this, you can come watch it tomorrow, there's this meeting that I personally think is a little bit crazy, which is the committees meeting. All of us are members of 2 standing committees. But those committees, over in Ulster and in other counties where I think the legislature is maybe a little bit more empowered, that's just my sort of take on it, and vis-a-vis other parts of the county government, those standing committees meet. But what our standing committees do, they're essentially just pass-throughs, and we all meet in the room together. And each committee sort of convenes itself in turn to decide which things come to the full legislature. It's a very peculiar meeting. But it involves the first round of debate and discussion, and some things pass and some things fail in committee. And you can take a look and see, if you're interested, the agenda's up there to see. That's another meeting, again, open to the public, and you can come and see what happens then. I encourage people to come to caucus and come to the legislature and watch it online, just to get a sense of the rhythm and of and it's the easiest way to find out what county government does, at least from the legislative perspective, is just to follow along and to know who your legislator is. The districts are very confusing. They are overlaid on top of the election districts in a very peculiar way, and it took me, when I decided to run for office, the first 2 months to figure out where the heck my district was, and I have lived there for 20 years. I mean, it's not because I'm new. It's because they are very counterintuitive and strangely drawn, and we can talk about that anyway, but that's how it is. The other thing I would say is, if you want to give this a try, and this is just a kind of brazen pitch for a resolution that I have, and some of us have up for tomorrow night. The volunteer committees that Mr. Kendall was talking about, there's not one web page in Dutchess County where you can find them all. Some of them, like the Environmental Management Committee, which Legislator Tyner is a liaison with, they have a fantastic website that really on their own, volunteers, they have put together a big website, and you can figure out who their chair is, how to contact that person, where they meet, what they're working on. There's a bunch of resources and documents up there. You can contact them, and if you want to serve, you know who to send a resume to, the whole works. There are other committees that you cannot find. There are several committees that just aren't there. I only know they exist because I happen to know somebody who serves on them. And we'd like to have that be more consistent. Not every single volunteer committee is going to have a big site, but for example, one that works on issues like Veterans Affairs, or suicide prevention, or really crucial issues, these really need to be visible. And so we have a transparency resolution in place that's coming up tomorrow night in committee, and we'll see whether it survives committee or not. And if you want to write to your county legislators at dutchessnewyork.gov, right, you can go write and tell your legislators that they should pass this. And what we hope to do is then ask the computer systems folks to create a page where it's really easy for everyone to find all the volunteer committees that exist in Dutchess County, and to have just the basic minimum of information. How do you contact the chair? And you know, if you wanted to serve, where would you send your resume to? And if you want to attend a meeting and just drop in and see what this TIC task force is all about and what they're doing, you know when and where. Just to make that a little more consistent. So if you want to follow a bill, you can follow that one, because I think it's a good one right at the moment to follow, because it's about that whole process of how do we get people involved. And that will either sink or swim tomorrow night in committee, and then it will then either sink or swim. If it gets past committee, it'll be on Monday night. So that's just a little bit. The only thing I would warn you about is a little bit about acronyms. There were 5 of 6 of us who are new to the legislature this year, and one of my new colleagues who has a great sense of humor said that what we really need is an anti-acronym committee, which we all immediately began calling the AAC. So there are a lot of acronyms, particularly on the Criminal Justice Council, and some issues. Really, you know, there's a lot there. But some of my colleagues are really good about, and visitors are really good about saying, stop, what does that mean? Mm-hmm. What are you saying? What is it? You know, because people get into this lingo, and so you should always just come and do that. Stop people if they're using an acronym you don't know until they explain it to you. And it's pretty easy to get involved. I would say, to me, the big thing about county government and town government is that it's really very much face-to-face, and it's very, you can really feel you have an impact. We had elections in 16 and 17, I don't know about 18, but in 17 we had elections that were determined by one vote. Several. That one of my legislative colleagues was reelected in the end, after all the absentees and everything was done, by one vote. And the supervisor of Pine Plains was elected by one vote. So if you ever think, you know, in the next big presidential election that you're just casting your vote into, it's a drop in the ocean, it's not that way at the local level. And certainly I make a role, I know Joel, we try to be accessible to constituents and available for those face-to-face conversations and get to know people. The number of people in my district, let's see, I don't know about the total population of my district, but I won about 1,400 votes. My opponent won about 1,200 votes. So that's roughly the size you're looking at for a county. They vary a little bit. But you have a sense that it's a really manageable size district, and you should be able to get in touch with your legislator. I can take more questions about that at the end, but I've taken up too much time because my job here is supposed to be an interviewer, and I'm supposed to put my interview hat on and to talk about the Stabilization Center. So I thought that maybe I'd start, Beth, if you just want to jump in and talk about the Stabilization Center as an example of something the county has done recently that's very cutting edge, and that then you can have a sense of how it got created and what different groups and people and individuals, you know, participated in creating that.
You got it. So my name is, this is really loud. My name is Beth Alter. Okay. Yeah, please. I get going in my ears. So my name is Beth Alter. I've worked for the county for the past 30 years. I'm a really proud Dutchess County employee, and I'm proud to be here tonight, even if I'm second string, to talk a little bit about some of the creative programs that go on in our county. So just to give you an example of committees, so we have a mental hygiene committee. There's a Department of Health committee. From the mental hygiene committee, there is a DD, a developmental disability subcommittee. There is a substance abuse subcommittee. There is a children's subcommittee. and a mental health subcommittee. So there are so many different ways to get involved. And when there are vacancies on those committees, we do advertise, and we do really invite people from all across the county to submit their resumes, be interviewed, and to bring their experiences and their views to our committees so that you can advise us and we can create programs accordingly. So just because you mentioned it, I'm going to say we also at the county have a resilience committee. The resilience committee is made up of county members, of citizens of Dutchess County, and programs from the county. And the real focus is to look at suicide prevention and to look at how to build resilience in our community. There's probably about 40 active members in the committee, and it's really quite inspiring to sit in that room and to be part of a group of folks who come together from all walks of life because they've been touched by somebody who died by suicide or because they work in an agency where that's the focus. So we really welcome involvement on so many different levels. So that's just my pitch for my agency. So I want to just let you know that the Stabilization Center is part of really a continuum of care. And in about 2015, maybe 2014, 2015, we did a gaps analysis to really look at the services that are kind of happening in our county and what else did we need. And so from that gap analysis, we happen to have in the audience a gentleman who is very involved in all this, Steve Michio, and his agency is People Incorporated. So from that gap analysis, we really looked at what kinds of services do we need to build that aren't in existence right now. And so I felt very fortunate to be in the position in my job to meet with Steve, and Steve and I together started a kind of an open forum for the community. And when I say community, I'm really meaning county, because people came from all corners of our county. It was an open meeting, and we had it monthly, and there'd be sometimes 60 people, sometimes 40 people, sometimes 3 people, and we talked about the mapping process that we went through and the holes that we as agencies saw in our system of care. And then we asked for the people who sat in the room with us to give us their impressions of where the gaps or the holes were in the systems of care. And so from that, we started to say, what do we need? What can we do? Steve was in contact with a gentleman in Texas and brought that gentleman here and really brought the idea of creating some alternative services to meet these gaps in the system. So they run in Texas, in Bexar County, Texas, what's called the Restoration Center. And that Restoration Center really was one place where people could go whatever their need was. And people here in Dutchess County started to get excited about that idea. So you don't need to go to the emergency department. You don't need to wait till your next appointment. You don't need to call your primary doctor. You don't need to talk to the guidance counselor. Maybe there could be one place where anyone, whether you're 5 years old or 75 years old, could walk in, and it could be mental health, it could be substance use, it could be somebody with developmental disabilities, could walk in and receive a whole menu of services. So Steve and this gentleman, Leon, made a presentation, and our county government really liked the idea. So Marcus got on board with this and really met with Steve, met with Leon, and from there, we were kind of instructed to kind of grow this idea. And so how we did that was these monthly meetings, and at the same time, there was a parallel process going on in this county where we said, if we're going to grow some new ideas, if we're going to grow some programs, we need to include law enforcement. And again, the county executive got on board and said, there are programs happening in different spots in the country that we want to bring here. And the program that we brought here is called CIT, it's Crisis Intervention Training. And it's a 40-hour training that happens for law enforcement. And the first 40-hour training we did was in June of 2015. It was so exciting. Marist hosted us. We have an educational team made up of a wide range of folks from different agencies who presented this 40-hour educational program in conjunction with Eric from the first one? Eric Weaver from Rochester, who has a training institute. So we got to teach alongside with this gentleman who's been doing CIT training for many years. And our own Dutchess County Educational Committee got to grow from that experience and to really learn how to do this curriculum. And it is a set curriculum. We have over 350 law enforcement folks in the county who have been trained. We've trained people from the Postal Service. We've trained people from probation, corrections, and state troopers. It is one of the, for me, it's one of the most exciting projects that I've been able to be involved with. Because what happens is you have a group of officers who come in and it's like, what am I here for? Why am I here? And by the end of those 40 hours, they're like, I'm so grateful that I was included in this training. So one of the benefits that we have now is we have a whole training room at 230 North Road, which is the center, the mental health center in Poughkeepsie. And we do the training right there. The whole back wing of that building has been totally gentrified to have all of our 24-hour services. The Stabilization Center is the newest part of the 24-hour services that we offer in Dutchess County. One of the most unique parts about the Stabilization Center, it's not just a county-run program, it's a partnership. And for me, being in on the ground floor and watching county government work with all of our partners was an incredibly rewarding experience. You know, when I think about the last 3 years, I think I get the icing on the cake for how I've gotten to participate, but to watch how our local government has said, let's do this. We identified the gaps. It was in children's systems. It was in adult systems. It was in easy access for substance use. People were concerned that when you go to the emergency department, that it could take 4, 8, 12, 16, 2 days sometimes, depending upon how busy it was in the emergency room if you needed mental health services. So what we've done in conjunction with our partners, and our partners are People Incorporated, Mid-Hudson Regional Hospital, Mid-Hudson Addiction Recovery Center, Mental Health America, and Astor Services for Family and Children. The county holds the umbrella. We have the license for the program, but we all work as equal partners in this program. So we all staff the program. We all kind of have commingled and done cross-training. So we get to learn from the folks who work for People Incorporated, who bring kind of their lived experience to the center, and they share with guests. We call folks who come to the center guests. We don't refer to anyone as a patient. You're welcomed in, no matter what the time of day is or the reason that you're coming to us. We have people who specialize in children's services. We have nurses 24/7. We have licensed behavioral health specialists, social workers, mental health counselors. We have CASACs. And our job is really to answer to any issue that you bring to the center. So we have had 5-year-olds. We have had 13-year-olds. We have had 75-year-olds. We had a 41-year-old man recently who has tried 7 times to come to us and to find his path to recovery from substance use. He seems to get to a recovery center and then leave that recovery center. So when he came to us the last time, he said, I burned all my bridges. No one's ever going to want to help me. And so we stayed with him. You know, we worked with him, and we found a placement that would help him. And he left us so grateful that we didn't give up. So sometimes the 8th time is the charm, sometimes the 15th time is the charm. And I think that what's really different about the service that we're providing, it's not medically based, it's not a specific therapeutic service, it's a welcoming, engaging, trauma-informed environment that answers to the needs of any citizen of our county who walks in. We had a 13-year-old come in who has spent 8 years of his life in either foster care or in a residential facility. He's getting ready to go home to a family member, and he was just so anxious, multitude of hospitalizations, very anxious, and they came to us instead of going to the hospital. So one of the staff sat with him for about 2 hours until he was able to articulate, I'm really scared that when I go home to this family member, I'm going to mess up, and then I'm going to be back in placement again. And I'm really tired of living in placement. And so we worked out a plan with that 13-year-old that 2 weeks and 1 week before he's supposed to leave to go back to live with the family, he's going to come back to the center. Because we worked on some specific coping strategies that young person could use. And it was his idea. He said, I might need somebody to help me dust off myself before I get ready to go. And so for him, knowing that he could come back, no questions asked, no issue, he could come back, he can meet with somebody, and we can kind of give him some prompts and supports to get him ready to go home, was a lovely thing. And he walked out with a smile on his face. I can, share that after the shootings in Parkland on February 14th, that lots of families came and said, we're really worried, we're really scared. And we were able to sit with families, we were able to sit with young kids who were scared for themselves, who maybe those shootings brought up issues for them that they'd never articulated before. They didn't have to go to the hospital. They had, nurses, social workers, everybody right there, whether it was 10 in the morning or 10 in the evening. The other thing that I think is so amazing that the center is able to offer, you walk in the door and you start your substance use recovery when you walk in the door. It doesn't matter whether you're using heroin, it doesn't matter whether you're smoking pot, whether you're drinking. We're going to welcome you in, and we're going to ask you how we can be helpful to you to make today the first day of your recovery. So we have some dedicated services at the center for sobering. We have done really well in connecting people to detox, and then from detox they go on to long-term rehab. We had a young person who came in who had been waiting for their appointment at methadone, and he came in and said, can I stay here because I'm really afraid I'm going to pick up and I don't want to use again. So he stayed with us. We walked him to his appointment at methadone. He's come back 2 times to thank us. We've had family members whose loved ones came to the center to receive services for depression. They were suicidal and had never experienced suicidal thoughts before. They came in, there was an evaluation. One of the key points of the center is when you leave the center, you leave with an appointment, you leave with follow-up. So the kinds of follow-up that you can have, all of our partner agencies in the community kind of have really stepped up and said, we'll see you tomorrow. Or maybe one of Steve's staff will go out and check on that person the next day. We have a mobile mental health unit that works 24/7. We'll go and follow up and make sure. Somebody doesn't get to that follow-up appointment, we will follow up again with that person and re-engage with them. So one of the unique things that we do from the center is we call you 7 days and 30 days after your visits to the center. We want to make sure that you were satisfied with that visit, and did you keep your appointment? And if you didn't keep that appointment, how come you didn't keep that appointment? Oh, you don't have transportation? Let us help you work on getting you transportation. Because what really makes a difference when somebody's having a hard time is how you engage with them, how you ask them questions, and how you give them the support that they're really asking for. So one of the unique ways that we're trying to do that is to really use all of our listening skills and all the training that we gave the staff before we opened, and all the shared expertise from our partners to really listen and to respond to what's being asked of us. The center is a one of a kind. There are other stabilization centers across the country, but one of the things that is very exciting for us in Dutchess County is the county executive said, okay, so learn about the other places across the country, but then bring it home and make it Dutchess County. And that's really what we have done. We took all the information that we gathered and we've made it very Dutchess County and really friendly to use. We welcome if somebody wants to come and see the center, as long as there are no guests. We tour people because I think that that's really how the word will spread, and the message that we here in Dutchess County care about every citizen, no matter what their issue is. We have a place for you to go. Now the most important thing to understand about the center is that it's one part of a continuum. We have contract agencies that run clinics for primary mental health issues, for substance use issues. We have a partial hospital program that's an alternative to going into an inpatient unit or as a step down coming out of an inpatient unit. We have services in our jail. We have a mental health team that works right in the jail. They do transition work when people leave the jail. And the hub of our system is our helpline. And so helpline's been around for 35 years. We started as a suicide prevention call center, and we really have become the single point of entry. So if you know somebody, a neighbor who needs assistance, you call helpline, they'll finish that call with an appointment, to be seen in any one of our services across the county. So Helpline is a resource that, let's say there's a community residence that is having a hard time kind of managing with one of the folks that lives there. The staff member or that patient can call Helpline and say, I just want to talk. Families can call, I just want to talk. We have talk or text. We have, oh, here's the bracelet. We have bracelets. We go out into every school district across the county and we talk about the prevention services that we have, and we talk about the Stabilization Center as one of a part, a continuum of services to really meet the needs of the community. I rambled on. Questions?
What kind of outreach do you do at the local school district?
So we also have a prevention coordinator that works for the county, and so we do.
No, that's me. I put mine on and then that
Okay.
caused trouble, so I'll turn it back on.
So we do trainings in every school district. Every school district has the bracelets. Every school district has these signs hanging in bathrooms. We meet with superintendents. We've done superintendents training days. We've met with all the school nurses. We'll do any training and any outreach that a school invites us to. The other service that we have in the county is we have a countywide trauma team. Unfortunately, when there's an untoward event, schools sometimes need extra support to help them and the students and the families get through. And so we have a trauma team that will go and work with every school district or any school district, any business, any family when there's an event to help plan how to respond to that event.
Thank you.
Just wondering if you can explain how this is funded, like in regards to the county level and.
Sure. To make that connection. So the county executive said, let's do this. Okay, and so we sat down as a partnership and said, how are we going to do this? And one of the things that happened from the monthly committees that we had, we kind of funneled down to weekly steering committee meetings. And the steering committee meetings were made up of the agencies who raised their hand and said, we want to sit at the table. And those are the agencies that I mentioned. So those are our kind of primary partners in this. We all made budgets for how much it would cost to have the different staff to staff the program 24/7. The county executive put out a bond to redo part of the building. I don't know if you've ever been to our building. It was built in 1968, and I don't believe much was done to our building since 1968. So what happened at the same time that all the planning was happening, Abilities First lived in a corridor of our, they had a school in the back corridor of our building. They found a much more suitable location and they moved out. The whole idea had really taken off about opening up the center, and then the bond was put out. And so that part of the building was the first part of the building that was rehabbed. And then we had to come up with a budget and how we were going to be able to pay for this, and we do bill for the services and hope that we will eventually be self-sustaining. But somebody's ability to pay is really independent here. Our job is to provide a service to anyone who walks in the door. Yes, sir?
I don't want to cut you off, but you describe it as walk-in, and it's wonderful that if someone walks in, they're going to get treated. But it just, my assumption and my stereotype is the people who really need help are in Amenia, Beacon, Pleasant Valley, stuck at home,
Great.
hurting themselves, and there's no way that they're going to walk into your facility.
So that's a great point, and thank you for the question, because we also have a mobile team, and our mobile team goes out to every corner of the community, of the county, 24/7. So we are in Amenia, and we will give you a ride if the center is the most appropriate place for you to be. We've given people rides from Eastern Dutchess, from Southern Dutchess. We'll go up to the corners of the county to help people get to the Stabilization Center. So, and it works.
The police do, right?
So the other thing that's happened, thank you, Steve, is to come back to the training that we've done with the police, is the police will bring. So about 290 times, I think we're up to, police have brought people to the center. And so it's a voluntary program. Okay, so you can't come in handcuffed, but the police from this training are motivationally interviewing folks and say, you know what, I know this place you could go.
Right, and as an alternative to handcuffs.
You got it.
They said, you got a choice
Yep.
here. Right.
So when police come to us, we're asking them just a couple of questions. One of the things that happens when police bring people to the hospital is that it can be an arduous process before the police can be back on the road. We listen to all that in the trainings that we do. It's about maybe 12 to 15 minutes that a police officer will stay with us.
Yeah.
So we ask them to sign their name, what jurisdiction they're coming from, are you CIT trained, yes or no? And if the center weren't here, would you have arrested this person, brought them to the hospital, or made a mobile team referral? So we're constantly asking the law enforcement across the county to think about this and to think differently about how you interact with people in need.
Has there been a noticeable change in arrest rates yet?
So, good question.
Could you please repeat the question?
Sure, have we seen a noticeable change in arrest rates? So it's one of the projects that we're just taking on. We opened our doors in February 13th of 2017. I just want to explain, go back and say to you that getting this place open, and then I'll go back and tell you the project we're going to do to look. Getting this place open, we had to get all the state regulatory agencies to agree on what to call us and how they were going to license us. So if you bring a bunch of regulatory folks together, it's not always so easy to come to some consensus. We were so fortunate because the State Office for Mental Health and the State Office for Substance Abuse Services sat in the room with us for quite some time. And we problem solved where then OASAS, which is the State Office for Substance Abuse Services, said, we're going to take the lead. We're going to be your host. And OMH said, you can provide all OMH or all mental health services also. And we're going to give you this license that we haven't really given out before, but we're going to test it out on you. So we're the state's guinea pig for running this kind of program. And so they gave us what's called an integrated outpatient service license. So we can bill for all sorts of different kinds of services under that license. We sent out our application. They told us in November of 2016 how they were going to license us. Our application went out on December 1st, and it was in our hot little hands on February 9th, and we opened our doors on February 13th. The only way things like that happen is because our county government said, we really believe in this project. They, along with our administration, spoke with the state level folks. All of the partners together advocated for this to happen. So this project, this stabilization center in our county is a growth from the community saying we need to do something different to better serve people. To me, this is the most amazing community project that involves county government and has county government support. Joel?
I wanted to thank you and Steve and Marcus for making that happen. It was actually a 2012 Criminal Justice Council Needs Assessment Report called for 24-hour mental health drop-in crisis center. So I was advocating strongly for it for a number of years. The building was there, and the training is happening for the law enforcement. The diversion doesn't always happen because I get these, I used to, the jail folks don't want to share with me anymore. But basically, about 12 different times over the last several years, I get the census report from the county jail. It's a 165-page document. I take an hour and I go through it. And usually there's 30, 40, 50, sometimes there's upwards of 60 of those, hundreds of folks incarcerated, are in there with criminal possession for a controlled substance. That's their only charge. Not being a drug dealer, not any aggressive or violent act, just criminal possession of a controlled substance. So what you're doing is fantastic. And I was at the Bardavon January 2015 when the county executive announced at a CJC meeting this is going to happen. Your program is awesome, and the training's there. But I'm just letting everybody know, because the media doesn't really want to report it, that there are right now at a cost of $125 per day, because not all the cops are diverted. That's the thing. And we have a DA who is, because I politely grilled him on this at meetings, District Attorney Bill Grady has fiercely, publicly, repeatedly defended the practice of locking up and arresting and incarcerating nonviolent drug addicts. So just very briefly, do you think maybe it might not be a bad idea for Dutchess to embrace the PARI approach? Because There are people in northern Dutchess now who, they only go to Chatham, and then they go to Chatham, and then they get brought down to Cornerstone.
So if I might just speak to how our thinking has evolved. So we're working with a lot of different court systems, and there are a lot of judges who are saying, oh, you've got a heroin problem. Why don't you go over to the Stabilization Center, and why don't you go to treatment? Let's keep you out of trouble. So in the city of Poughkeepsie, there's one judge in particular who has really made it his passion to try to assist people not to be in jail. So as we evolve, as the Stabilization Center evolves, as we really look to build services out, we do pretrial diversion, we do transition for folks who come out of the jail. They come over and see the center so that they know there's a safe place for them to be. We are working tirelessly to come up with lots of different ideas to engage folks and engage people who have a disease that's a really hard disease to get under control, and that's addiction. It's a very difficult disease, and lots of things happen when you have that disease. We're offering a wide range of services to really address the needs. And I'll just give you an example of one of the things that is different. When you're a Dutchess County resident, you leave the county to go for rehab, and opiate use was your primary reason that you went to rehab. When you come back, the mobile team will see you within the first 24 hours of your re-entry into your home community. These are just little ways that we're trying to interrupt the horrible pattern of overdose and deaths. So we're trying to always come up with creative ways to best meet the needs and to interrupt the pattern of use that unfortunately ends up in too many deaths.
Actually, I wanted to ask Rebecca if you would share with us the story of how you first decided to run. And thank you, Beth, so much for
I'm going to sit over here, but it's okay.
amazing talk.
There might be more questions for you, so don't go far, right? I would just say that to follow up on what both Beth and Joel were saying, that also you get a sense here that there were people in the legislature, including Joel, and people on the CJC who were advocating for this. There were a number of groups that were involved. The executive is very powerful in Dutchess, and it was a very important moment when the county executive decided that this was going to go forward. When the bonds came forward, it was the legislature that needed to pass those bonds, and so there's different parts of the group of the county government that need to kind of work together, as Beth said, to make that happen. I decided to run after Trump. In fact, the interesting things about running in 2017 is I think it's difficult to run. I think maybe it's particularly difficult for women to run. It seems like an egotistical thing to do. It actually didn't seem as hard in 2017, maybe at least as a Democrat, as in other years, because nobody really asked me why I was running. Everybody was just like, yeah, I'm running too. So. Or like, I have web expertise, or I can do public relations, or I'll raise money, or I'll whatever. I mean, it was very much of a movement feel to it, and that was really great. And it was important to me, and it's something that both drove me to run and then also has been confirmed since then, that I think maybe particularly people who are to the political left, but maybe this is true of everyone, that because of the way media works, that we tend to think of important issues being at the national level or at the international level. The United States is very important in the world. Foreign policy is not something that we, thank heavens, have to deal with in Dutchess County. I'm really, really glad the county legislature doesn't have to do anything about the Middle East. I mean, we have specific things we do work on and others we don't. So maybe that's why our national focus is very much at the national, federal, and international levels. But there's, I think what Beth was talking about, I mean, we have a major national problem with opiate addiction, with alcoholism, other issues like this. And a lot of the solutions are local, and I think that's true of climate change. It's true of a lot of different issues. The federal government can and should do a lot about climate change, in my opinion, but if we're going to switch from fossil fuels to non-fossil fuel use, it's going to happen kind of house by house and community by community and county by county and town by town. So in a lot of ways, there's so much you can do. And I'll say that it's been empowering to me from the moment that I ran and now that I'm in office, sometimes to look at the newspaper in the morning and kind of go, can't do anything about that, putting that to the side, gonna do something that feels constructive and useful and helpful here. because, we're all faced with that. I think a lot lately. There's a line from a Pink Floyd song. When the newspaper comes in the morning, the paper holds their folded faces. The lunatic is in the hall. The paper holds their folded faces to the floor, and every day the paper boy brings more. That's kind of how it's felt to me in the last few years. And being able to do local government to me feels constructive and positive.
Can I just give one more pitch? You said keep it local, and I just want to say that one of the resources that we have is Dutchess County has an app. And I left some stuff in the back. If you have a QR code thing on your phone, you can do it right from the QR code, but if not, if you put in Dutchess Helpline, you can download the app. And it's a suicide prevention resource app. I call it, you said keep it local, I call it a citizenship skill. I think everyone should have the app downloaded on their phone, because you might bump into a neighbor or a friend that doesn't know about a resource, and there's a whole area of Dutchess County resources on the app. You might not know how to respond to somebody who's having a hard time, who you meet, who has an addiction or is suffering with depression. There's what to say on the app. Most importantly, at the bottom of the app, there's a little balloon for you to press and you can text, or a button that you can push and you can call. And you'll come right into a local resource, which is Dutchess County Helpline. You don't know what to say to somebody? Press the button, call Helpline, and the Helpline staff will help you figure out how to help your friend. So I told my kids when they were young, when we first got the app, you download it because I expect you to be citizens of our community. And so if you see somebody in need, you help them download the app. You help them access resources. And for me, that's kind of the proudest moment for me as being a county employee, working for in mental health, is being able to kind of share that assistance, share that support, and most important, share the hope that today might be the day that something's going to turn around and we're going to do it different. We're going to help connect you. Today's going to be the day that you're going to feel the hope.
Rebecca,
Yes.
since you're here, a unique opportunity, like a philosophical question. Students. Students are our future. Students are the country's policies of the future. Students. But they're possibly have a home address which is more permanent than their school address. So this is just philosophy. Doesn't really truly affect me. But should students... they should get engaged, and they're not at home during election time. They're here on campus in Dutchess County. So should they vote here? And how much influence then do they have on taxpayers if they don't pay taxes?
Well, I can give you some numbers. Vassar College is actually divided up in a very peculiar way that we won't talk about in terms of county legislative districts. But I have a little chunk of Vassar in my district, and I have 77 students there who are registered here. I have 400 voters in my district who are between 18 and 23 who are not Vassar students. Many of whom are in Binghamton or Plattsburgh or wherever else they might be, or who go to Dutchess Community College. A third of our high school graduates go to Dutchess Community College, or they're working or whatever. So to me, I think that a lot of those Vassar students actually are voting at home, and they're home. So I think all college students should vote. I believe deeply that they should be engaged, and I think they should decide where to do that. I would say from my anecdotal experience that a lot of Vassar freshmen tend to continue to vote at home because they're very engaged at home. But if they, like many Vassar students, and I speak from Vassar because that's my own experience, but I know Marist and DCC and other students as well, if they come here for a year, they work for Hudson River Housing in an internship, they get involved in the community. I had 2 students who were interns with Bill Grady in the DA's office, right? Things of that sort. In a year or 2, they're engaged here and they want to vote here. And I think we should empower them to do either. I'm particularly worried about the ones who don't do either. And I think sometimes we think of this as an apathetic generation. I certainly don't see that in any way. I think they're going to save us. They're incredible. I'm a little bit biased in favor of my students, but they're fantastic and so committed and so serious. But I realized during my campaign about the information gap, because I was going to house after house and looking for a 21-year-old voter who was in Vermont or wherever at college in October, and I couldn't get them. It's to give their mom and say, would you please send them this absentee form so if they want to vote, they can, right? And so we're spending some time this summer actually going around and looking for those youth voters to say, hey, are you home for the summer? Where do you go to college, or where are you? Do you go to DCC? What's, you know, to see if we can reach out to them and make sure that they have the tools to vote. Because if you're at college and you're not getting information from home, and you know the local news media now has kind of eroded, and that's another issue. It's harder to get information. It can be a challenge. So I think that might be one of the reasons why there's a lower voting in that age group. Yes, Joel and
I just had a question for, I don't know what your name is.
Beth.
I know we're focused on Dutchess County, but I'm just wondering if you know of anything similar in Westchester?
There is no other stabilization center. We've had folks from Westchester come up here, so there's
They
not.
will be served.
Uh-huh.
You will serve Westchester?
We'll serve anyone who approaches our door. That is our mission, and then we help connect them back to their home community.
We are working in Westchester with the Westchester government to start a stabilization center right now.
Do you think that because, you know, Rockland County passed their campaign finance reform law in 1997, Orange County Legislature with a Republican majority passed their campaign finance reform law in 2013, never been challenged in the court of law. Do you think that maybe perhaps that, in a little bit of contrast to my good friend Brad, that maybe might not be a bad idea for us to pursue campaign finance reform?
Okay, you can tell Joel and I are in the same party.
Can I give a plug, Joel? Come back next week because the talk is all going to be
I know,
about
I'll be
campaign
here.
finance reform.
I will say I think that there's an interesting, I was going to talk about the ERPO bill also. So there is an interesting thing where, like, for example, right now, New York State is considering an extreme risk protection order bill, which is a bill that allows people who are close to someone who may be at risk or of suicide or of violent act of some kind to work with police to secure any guns they may own. The county, some of us in the county government are monitoring what's going on at the state level because it's passed the assembly, it's in the Senate, the NRA is not opposing it, and it may pass. But the Senate's kind of in chaos. Actually, Albany's in chaos. So we're waiting to kind of see what happens. And if it didn't pass at the state level, we could try to see if we could do something like that in Dutchess. It's reduced the suicide rate considerably in Connecticut. And so there, I mean, it seems to help. So we're looking at that, but it's an example of how the state, right, it would be better for the whole state to do it, but if they don't, we could maybe have Dutchess take the lead, and then maybe sooner or later that would be superseded by a state bill if they ever got it passed. So that kind of suggests how that's worked. Campaign finance reform is the same way, and I would agree with Joel that I'm not sure I don't necessarily agree with Brad that it's not possible for counties to do something on that. But again, that interplay between county and state is a little complicated.
Yes, I should probably have asked the previous speaker that, redistricting. When was the last time we did it here, and are you familiar with the genesis of redistricting, how it happens, how we get perpetrated in redistricting and so on?
Are you talking about county level
County,
districts or
yeah,
state?
county.
Well, we're doing county tonight, right? So, okay, good. So yes, it's done at each census, right? And Joel can correct me if I'm wrong, but last time around, there was one session where it was a Democratic-controlled legislature that wanted an independent commission to draw the lines at the county level, and then the Democrats lost control of the legislature the next time around, and then it was put back to another system of drawing the lines. So it's a contested issue, it's a contentious issue. Needless to say, there's another census coming up, and there's a great desire everywhere, all over the country, for each party to have some control over that process. I mean, I think one of the things that I believe Cuomo promised to do was to have an independent districting commission at the state level, and then that promise was not fulfilled, we'll put it that way.
Just real quick on that, we passed the law in 2009, the Republicans repealed it at 1:30 in the morning in 2010, and for the last 8 months, there's a Dutchess County Government Ethics and Independent Reapportionment Committee that's been kind of meeting kind of semi-secretly. No minutes are being held of those meetings, but just so you know, you're all invited. I'm going to be there tomorrow at 5:30.
Oh, good.
On the 4th floor in the county attorney's office. The whole thing's a joke. It's beyond a joke. So please, because it's coming around. So please raise hell. I've already submitted legislation for Dutchess County to pass the same law that Ulster County passed for independent reapportionment. Actually stronger, so that we have to go by whatever the committee comes up with. But tomorrow 5:30, and like no minutes are being kept. Rebecca's absolutely right to push for the transparency. There are absolutely no minutes for the Dutchess County Ethics and Reapportionment Committee.
I'll be nonpartisan here and just confirm that I think districting and things like early voting at the state level, which you could talk about next week, right, are also really crucial issues to get involved in, because the process itself has to work in order for them, for then people to be able to make decisions.
So I'm just going to jump in, and just say we only have time for one more question, and I would like it to be you, since you prepared some questions for Beth. So I just wanted to give you the opportunity to ask her one thing, and then
I get one.
Yeah, and then pick a good one,
that's good,
and then
'cause
we'll
it's
wrap
good.
up for the night. And I hope everybody is RSVP'd for next week's class. You can do that on the library, and please hand Katie your things. But just stay for a moment and hear Rebecca's scintillating question.
I'm going to ask you two questions, Beth, and then let you pick one, okay? So that you get to pick. First of all, can you sort of say something about the circumstances that helped the Stabilization Center get traction? Like, what was it about that moment that enabled this to happen? Or have there been moments going along that are kind of, sort of aha moments about how it came together? I think anything you could say about the sort of process, any further things you might want to say about the process of how it came to be.
So for me, the aha moments and how it came together really have to do with how we work together as a community. And all of the kind of the contract agencies, private agencies, nonprofits came together to really talk about how we want to see our system of service in Dutchess County. And county government really was working side by side with all of our partners to create the center. You don't get a better aha moment than the government saying, yes, this is what we need, and supporting it 100%, listening to the people who have the expertise in terms of developing the services, and our county executives saying, go for it, let's do it. Let's be the first one in New York State to create a service where anyone, any age can walk in and really start on their recovery.
And please come to caucus and come to the legislature and come and participate. It would be wonderful. Thank you so much for being here.